Well, hello, everybody. This is BJ Murphy, publisher of nonessential.com. And we have a very exciting broadcast for you today, this coronavirus chat that we've been doing. We've had 3 over the past week. And this is the first time we have ever actually done a live stream chat where our tech engineer, Dr. Travis Town, our VP of Operations, Aletha Thrower, is going to be on the social media. And we've done it with me and him in remote locations, but this is the first time we've ever actually had a guest come on to do that exact same thing. And the reason why we talked about this as a team, made this decision, actually after the last time Dr. Pradeep and Senator Perry were with us, was that we said, what can we do to limit the exposure for each other and practice this actual social distancing ourselves? And with all the technology at our disposal, we said, well, this is a way we could do that. So thank you so much for joining this broadcast. It's the first time we've ever done it this way. And if you don't mind, if you have a question, don't hesitate for Dr. Pradeep, don't hesitate to drop it in the comments below. We're going to do our best to get to them. We've already talked to Dr. Pradeep about some of the ones that we've had from our We Report News Facebook group, and even comment on our Facebook page. Also, please go ahead and share this broadcast, because there's a lot of information going around, unfortunately, a lot of rumors as well. And maybe there's some practical guidelines that Dr. Pradeep can give us today that will help you, help your neighbor, help your family. And so we just want to make sure that we share this accurate information as timely as we can. And so we want to make sure that you get that information to the folks that you know in your circle and your sphere of influence. So please go ahead and share this broadcast to your timeline. Also, I want to give you a quick update, and then a couple announcements I'll bring on our guests. At 10:16 this morning, North Carolina reported 255 COVID-19 cases. The U.S. and this was as of 10:16, had 15,219 with 201 deaths. Luckily, in North Carolina, there's been no deaths reported at that time, and I haven't heard any since. But at that time, and we have had no confirmed cases as of this morning in Lenoir, Greene, or Jones County. Tomorrow, just to kind of give you a little heads up, tomorrow we will be joined, and we will be doing this exact same broadcast, but we will be joined by North Carolina Senator Jim Perry, and he is going to talk about, there's been a lot of questions about the financial assistance for individuals thinking about unemployment related to the economy. There's been a lot of questions for small business assistance as it relates to the downturn that's hit us all of a sudden. And he'll certainly give us an update on the state briefing. A couple other announcements I want to make is that the American Red Cross, we had a chance to chat with them this week. They're going to be they're in desperate need of blood. In fact, I actually, on the way over here, heard the Health and Human Services Secretary for the United States, Dr. Ben Carson, actually mentioned the exact same thing. There's a huge demand for blood right now. American Red Cross is going to hold 2 blood drives this week. On Wednesday at Wednesday 3/25 at the Cooperative Extension office here in Lenoir County, they're going to have a blood drive, and on Friday 3/27 at the Deep Run First Baptist Church. There will be, when we finish this broadcast, there's going to be a link in the comments so that you can get registered to get the information. There's a link. There'll be a link in that story. The article we published, there's going to be a link for both the Cooperative Extension and the Deep Run. And please, please, please register before you go. They need blood, but they need you to register so that they can reduce the social distancing and reduce the potential for people to get in too much contact with each other. We had some questions from our We Report News Facebook group. If you're not a member of that, please join that. It's a great place for neighbors to help neighbors. In fact, we made it really easy. We Report News.com. Also, if you noticed this past week, if you want to help chip in with Neuse as we kind of go through this time together, we're doing these limited time hashtag Neuse Crew t-shirts. You can chip in $5 or $50. It doesn't matter. If you chip in, we're going to give you a t-shirt. We'll get those printed the next couple of weeks. So we'll make sure that you get that link in as well. Feel free to subscribe to our newsletter. It's free. It is basically all the day's top headlines at 7 o'clock in your inbox, and you can have it as we report it here at Neuse. And you'll see the link at the bottom of your screen, that little red ticker. we decided early on that we would take all of the COVID-19, the coronavirus stories or articles or releases that we've done and put them all on one link. And so you'll go to www.neuse.news/CV, neuse.news/CV. Just bookmark that and go to as often as you want. We're going to have that updated all the time. And the last thing I want to mention is the state of North Carolina has come out with NC 211. NC 211, it gives you accurate information related to COVID-19 as it relates to the state of North Carolina. You can actually you can send a text to COVIDNC, COVIDNC, just one word, to 898-211. And again, we'll make that in the comments and link that here in a little bit. But right now, we are really happy to be joined by Dr. Pradeep with Vidant Health. He has been a well-respected physician here in our community, has been for a long time. And I just want to say thank you so much, Dr. Pradeep, for jumping on. Is there anything you'd like to say as we kind of get started?
Thank you for inviting me. I understand this is the first time we are doing it, and there's a small lag in how we speak, but hopefully that does not come up on the video. Okay.
You sound and look good.
I did shave my beard. Okay. As part of this COVID-19 business, I have to shave my beard because the CDC says having a beard is an increased risk, and being a healthcare worker, man, I cannot wear a mask.
Okay.
I know, you need to shave too.
Man, so, my kids are going to like you, Doc.
Okay, so you said you had some questions, or do you want me to go
through? Sure. Let's get an update. When I started the broadcast, we said that this morning there was 255 cases in North Carolina, and that's because they're only updating that number officially once a day. But I know there's some other news sources that have that information, a little bit more regular updates. Can you give us an update from what you know?
Yes, the website that I follow is from the Johns Hopkins, and if you look at the Johns Hopkins website, they have 286 patients today, and if you look at the total U.S. cases, there's 31,057 cases. Okay, that's way more what the NCDHS reports, and it's not like they're not wrong. It is just that there is a lag time in what they report. Okay, the Johns Hopkins website says 31,000 patients. That's a whole lot of patients. When I was doing my initial projections, we were supposed to reach 36,000 by around 3 days from now or something. Okay, but I think we're going to reach 36,000 by tomorrow morning. Now, I suspect it is because of increased testing. All those tests that we have done, the results are coming back now. Why? Because there is a lag time. The COVID test, they say it takes 6 to 7 days to come back, but in reality, it's coming back like 2 weeks. Okay. Sorry, not 2 weeks, almost a week. So we still don't have enough testing to do. So, we probably should treat everyone like they have COVID, but we cannot do it because of the lack of supplies. We can't test everybody that walks into the hospital for COVID. So for now, we will still have to ration the test for a while before we can. And once the number of cases go up, then we will start testing for COVID or coronavirus first. Right now, the way we are doing it now is if you come in to the emergency department as an emergency, you don't come into that's something I wanted to stress. Just because you feel like you need testing, the emergency department is not the place to come to. Okay. If you think you are sick but not that sick, the first thing to do would be to call. There's a number for UNC. It's 1-888-850-2684. We will put that up in the end. It's 1-888-850-2684. So what they would do is they will register and then have you checked. Okay. Now, in case you're coming in with an emergency, like you call 911, you are really sick and you end up in the hospital, the next thing we would do is we would first test for all the common viruses, because you don't want to test everybody for the coronavirus. We want to start with the flu test and all of that. And if all of that is negative, then we would go with the coronavirus. Okay. On-site testing. We still don't have on-site testing in Lenoir. Okay. In Vidant in Greenville does have on-site testing. or at least I think they do. Now, so on-site testing will be available hopefully in the next 1 to 2 weeks. Okay. Now,
Okay.
what are we doing here in UNC Lenoir? We are trying to limit the number of patients coming into the hospital for multiple reasons. One, to prevent people infecting other people, and for their own safety. So for now, there's going to be only one entrance. You have to walk through the ER entrance. And then in the lobby, there's going to be a person sitting there preventing people. They're not going to allow more than one visitor per patient. Okay. So I suspect in the next few days, there's going to be a policy in place saying no visitors at all, and we're going to make sure that that gets enforced. In the next few days to weeks, we are going to have a lot more restrictions in place. Nobody likes it. We don't. But unfortunately, that is something we have to do to control the spread. Okay. Again, remember social distancing. We are trying to reduce the number of cases per day. We are not trying to reduce the total number of cases. We are only trying to reduce the number of cases per day.
I saw an expert earlier, an expert on polling data as well as language we use, and he was concerned that this new term social distancing is a little confusing because it's not something we're used to hearing, and so it may not be as clear. And so he was like, maybe a better way to say it is, hey, look, stay at home, get your groceries once a week instead of every other day. And try to do things that limit you from being out, exposing yourself to the public or interacting with the public as a way of practicing the actual social distancing.
Every time you go out, you're liable to expose yourself or to expose somebody with the virus. Okay, because you're touching railings, you're touching the knobs, you're touching the grocery cart. I mean, you're doing a lot of things that you don't even recognize. I have reduced my handshaking, but still, the first time I meet the person, the instinct is to put your hand out.
I came into the office this afternoon. That there may be just one person in this building, and I found myself wiping down the door handles, wiping down the knobs, and wiping down my desk again just to make sure it's all good. Maybe a little paranoid, but I prefer to be a little bit like that than just be kind of non-compliant with it. We did have a few questions earlier, and look, if you're watching this live, I see there's a lot of folks watching this live, and thank you so much for tuning in. It's BJ Murphy. I'm with Dr. Pradeep to kind of talk about the coronavirus and what we can do to better protect ourselves. Dr. Pradeep, if you've got a question, drop it here in the comments below. But there were a handful that I was able to look through earlier, and I will, if you don't mind, the first one came from Kelly Howard. This was in our We Report Neuse Facebook group. And the question was, do we know the likelihood of the coronavirus coming in waves? And is it possible that we could go through this wave only to have another one this fall or winter?
It's very possible because that's what happens with the flu. Okay, so if it follows the flu pathway, it probably will follow the same pathway. Now, what will be interesting to see is what happens when we relax the social distancing policies. If we relax the social distancing policy and then the peak starts again, so we'll have to figure out what is going to cause the peak. Is it because we're going to reduce the social distancing, or people get tired of it and start doing whatever they want to do? So all of that, only time will tell. This is all uncharted territory. Who knows what is going to happen?
Right. Yeah, and I've had the conversations with my wife and my girls about understanding. Look, we haven't gotten an official word from schools, but we're pretty sure they're not going back anytime soon. And so for their mental health, they still need to interact with their friends. And so there are apps like FaceTime or Kids Messenger, where we're going to try to start scheduling these virtual play dates and time those so that they can still spend time with their friends and not be on their device all day, but at least still try to connect with their friends because we really think that's very important for them. There was another lady, Berna Bright. This was also in our We Report News Facebook group. And she more or less asked, hey, if employees at grocery or retail stores wear gloves, does that actually help reduce the spread of the coronavirus?
Clearly, it will help. It'll help protect the employee and the person who's buying the grocery. Okay. Now, will it be 100%? No, absolutely not. That's and what can you do? I mean, you wear the gloves. Do you change it for every person that walks through? Now you're using a lot of gloves. And you're depleting resources, which we don't have at this time. We are underprepared for this. And again, nobody knew this was going to be this bad. Okay, so will it help? Yes, absolutely. There is no question about it, and I would insist that they wear gloves.
And the same thing for masks. I've seen a lot of conflicting reports about, do masks actually help protect the public, protect you? What's your take on masks? I've also seen where some officials have said, look, to the public, stop buying the mask because we need them in our hospitals.
So the mask primarily will protect people from spreading it. How? Because if you're sick and you're coughing, the mask will prevent a whole lot of droplets to come out. Now, when you inhale, will that mask prevent you from inhaling the droplets? Very little, because those holes in those masks are much higher than what is required. Now, the N95, those painters' masks, they do a pretty good job of it. That doesn't mean you go out and get all the N95 masks out there and put it on, and which will deplete all the resources again. Will it help? Yes, it will help. But what I would tell you is to ration it in the sense, if you are sick, wear it. If you're not sick, don't worry about it.
I understand. And speaking of these droplets, I heard you say it. We also had this question from Judy White in our We Report News Facebook group. And she asked, has it been determined yet as to how long the virus droplets last? And we might want to explain what the droplets are. But the question was, has it been determined how long the virus droplets last in the air and on different types of surfaces?
So when we talk about droplets, when you cough, you may not see these droplets. They are all microscopic. Okay, there are YouTube. I used to think they were cool YouTube videos of people coughing and seeing all those droplets come out. Now it is a little scary. Okay, so those droplets can hang around in the air for at least 3 hours, which means, like one of my friends who's a dentist was saying, if he does a teeth cleaning and then for 3 hours, it's going to hang out in the dental office. Okay, so so if you cough in a room, it's going to hang out there for 3 hours. Okay, so at least 3 hours. Now there are studies that showed that on copper it lasts for 4 hours. Now on cardboard it lasts almost 24 hours. Okay, stainless steel and plastic, it can last for 72 hours. So those doorknobs, those handles and all of them, stainless steel, benches and everything, it can hang out for 72 hours. And that's another reason why we say don't go to these places. How these restaurants have all these chairs outside and the tables outside and people go sit there. We're basically trying to cheat the system. It's not going to work. Okay, you still want to practice social distancing. I agree, everybody's only trying to survive, but still that is not right. Because like I said, on stainless steel and plastic, it lasts for 72 hours. Okay, so if a coronavirus patient sits there and coughs on that table, it's going to be there for another 72 hours unless somebody cleans it.
Yeah, and I was good. There was a question earlier I saw about takeout. Alita, can you find that? Oh, here it is. Is it safe to order takeout as far as contamination from the preparers, the actual people who work at our restaurants?
It's a hard question to answer because let's say the person who has the infection, okay, and they cough onto a cardboard pizza box. It's going to be there on that pizza box. My advice would be to take as much precaution as possible. And the restaurants and all of that, if they are sick, they should be staying home. They should not be coming into work, which is normally what we would do anyway. There is an onus on both sides, the preparer and the person who's picking up. So they need to be careful. They need to be careful how they deal with food, which is what normally they should do anyway. So I don't think it is that big an issue. Right now, it is a big issue because of because the virus does transmit pretty easily.
Right. So the idea then of maybe you yourself making sure you're wiping down the packages you're receiving,
Exactly.
grocery bags, or make sure you're washing the meat, the vegetables and the packaging to make sure you're rid of the virus. Is that like a practical thing people could do to reduce the chance of spreading?
What I do is, if I go pick up food, I come home, I wash my hands very well, wash everything very well before I even eat. Okay, and I put it on a separate plate. I pick up the food and put it on a separate plate that I have at home, and then eat and take out all the rest of the stuff outside. I don't keep it inside the house. Does it completely avoid infection? No, it is not going to completely avoid the infection, but it will reduce my chances a whole lot.
Right. No, that makes sense. There was a question, just kind of a clarification from something earlier. It said, why is UNC Lenoir 2 weeks behind, or did I just misunderstand that? I guess that was referring to the testing that they're doing?
I wouldn't call them 2 weeks behind. That makes it sound bad, okay? Every hospital is behind. The bigger the hospital, they get it earlier, okay? And which is what you would do, right? I mean, if you think about it, if you're serving a huge population, they should be getting it first, So they're not. I wouldn't call them behind. They are moving as fast as they can. It's not like they are not behind. It's just that's all they have.
Right.
So
understand.
In like a week or two, we should have full on-site testing capability, and that's the best any of these small hospitals can do. I mean, I'm pretty sure Goldsboro is going through the same thing. Tarboro, Heritage, all of those hospitals are going through the same thing. Now, you cannot compare Vidant or UNC Rex or UNC Chapel Hill or Duke to Lenoir, because they are going to get all that stuff in the beginning. Not because those people are more important. It's just because they serve a larger population. And that's, to me, that is fair.
Right. It makes sense. I mean, the number of cases in Wake and Mecklenburg are significantly higher than Chatham or Wayne, just because of the density of population. In fact, there was a question: is the reason there's no confirmed cases in Lenoir County yet because there's no on-site testing here? I mean, we're pretty confident there have been tests done here, but the question was, and I think, Doctor, you pretty much said this earlier, that there probably are positive cases here. It's just not everybody is showing the same types of symptoms. They may not think that this cough is worthy of calling the doctor. And so there probably are people who have it who aren't calling the doctor or aren't actually at the hospital.
Now, what I want people to understand is the testing, we can do whatever the testing, it really doesn't help that patient. If you think about it, BJ, let's say you come in and tell me that I want my test done, okay, for whatever the reason, okay? I do the test and it's positive. It doesn't mean anything for you. Just because it is positive, there's nothing I can do to treat you. There is, I'm still going to say, go home, take Tylenol, rest, and ride it out, is what I'm going to tell you. And unless you're very sick, you get short of breath, then I put you in the hospital, in the ICU, those kind of things, okay? So just because we did a test, it's not going to help that person who had the test, okay? The test will only help you from preventing spread. Like you come in and I did a test and it's positive, then I want you to be careful with your family. I want you to find out who all, for contact tracing, it would really help, okay? So yes, should we be doing more testing? Yes, we should, but unfortunately, we don't have enough tests in this country as a whole. Okay, so it's not just Lenoir, it is not Greenville, it is not North Carolina. We just don't have enough tests. All these LabQuest, all those labs are way behind in their testing because they don't have enough reagent, because they're overrun with these tests. If you look at the statistics, it's I think it's like 20 or 30 times the number of people who are testing positive get tested. So our testing has ramped up, and you can see that in the numbers of cases. The cases have gone up. I think it is mostly because of the testing becoming more rampant. And I think in the next few weeks, it's going to exponentially increase. The testing is also going to exponentially increase, and hopefully that will show a change in the way we control infection.
The one question earlier, and this is kind of a generic question, I guess, but there's a lot of people watching. In fact, I'm looking, there's well over 200 people watching us live right now. There's going to be a lot more people who watch this later on our YouTube channel or even on our Neuse Facebook page. But this question was more or less put in our We Report Neuse Facebook group earlier, and it basically said, if I'm watching this, I'm watching the news, I have a heart to serve, I want to help. How can little old me at home help the greater good here? What can people really do to help what's happening in our country, in our world?
I hate to say it, the best thing you can do at this time is to sit at home and watch Netflix or something. Social distancing is what we should do. I mean, yes, I hate it. Everybody hates it. We all would like to be out there, but that is not the thing to do at this time. Now, are there other things you can do to help? I mean, like making masks and things like that. People keep sending me these plans and all of that. At this time, the studies have showed that the mask that we make at home really doesn't help as much, because again, the pores, the holes in that cloth is not that wide, Now, so for now, this is what I would tell you. 1, stay at home. 2, try not to overwhelm the system. In the sense, just because you want a test, don't pick up the phone, call 911, come to the emergency department, call your primary care physician. No, call, if you want to, you can call any one of these numbers that we have up, talk to them, and then decide if you really need to be tested or not. Coming into the emergency department for unnecessary things, and we all see this. I mean, people come in for all kinds of things, toe infection. I mean, those kind of things have to be stopped. It should have been stopped long time ago, but for now, we're going to take it a little bit more seriously, because you want all those beds as empty as possible.
And I know tomorrow at 4:00, we're also going to have Senator Jim Perry, and so I'm going to talk to him some more about some statewide policy, as well as get an update on the small business individual assistance. One question that I've seen, and we'll probably talk about it again tomorrow with Senator Perry, is, this idea of closing businesses, non-essential businesses, salons, nail salons. Do you think that is good practice for us to consider, either on our own or have that mandated to us?
Again, these are all tough questions, because it's
Right.
people's livelihood. Okay, people's livelihood.
Right.
I mean, on one side, you're looking at a lot of people dying. On the other side, you're going to kill them with their economy. So, and I'm pretty sure Jim is going to say the same thing. There are no good answers here. There's actually one other school of thought, and I'm not promoting it. In England, Boris Johnson started this whole process saying, we are not going to shut down anything. We're going to let it run its course. Okay. He didn't come out and say the exact same words, but that's what he meant. He said, people are going to die. Let them die. We will get herd immunity and move on. Now, is that right? Who knows? Who knows? But it would be hard for me to say, let's try that. Because I have parents. I have children. I have sisters.
Right.
I have friends. I mean, do you just sacrifice them, or do I sacrifice myself? I mean, what can you do? I mean, shaving off my beard, I can sacrifice.
You're talking me into it. You're making me mad. No, but look, I mean,
it's hair, man. It'll
all can
grow back.
I get it. In fact, this may be the moment where I actually get to shave my head. So, I mean, let's if we're going to go that far, let's just go ahead. There are other questions about daycare and other things, and we'll get to talk about some of those other state policy issues with Senator Perry. Dr. Pradeep, are there any kind of closing things that you want the public to do? And after you kind of close out, I want to let you go, and I want to give a few announcements and make sure we put some links up there. But are there any closing remarks you'd like to give the folks who are watching us?
Well, like I said before, we are all in this together. This is a 30 kilobase RNA. It's a small, very small virus. You can put 20,000 of them in one pinhead. Okay.
Wow.
It took that to tell us that we are all human. We are all in this together. Whether you're black, white, brown, Republican, Democrat, religious, not religious, it does not matter. It's going to come after all of us. Okay. So we just have to stand together and fight the fight. Fight the fight.
Right. Well, thank you, Dr. Pradeep, for jumping on here today. I really appreciate it. And we will have, for those watching, we will have Dr. Pradeep on later this week. We'll make some of those announcements as we get into the week. It's a lot of information, but thank you, Dr. Pradeep, for jumping on here today.
Thank you. Thank you very much.
And with that, stick with me just for another moment here, everybody. I want to make sure, because we have so many people jump on after the broadcast started, I want to make sure that I mention a few announcements, and we're going to, Aletha, if you don't mind, start putting these links as comments in the post. The first one I want to mention is American Red Cross. There is a huge shortage of blood right now across our country, and definitely here in Eastern North Carolina. The American Red Cross is having 2 blood drives this week. On Wednesday, 3/25 at Lenoir County Cooperative Extension Office. On Friday, 3/27 at the Deep Run First Baptist Church. We're going to put the link to the story, and in this story, there are 2 links to register. One for Wednesday's event, and another one for Friday's event. Please, please, please don't just show up. Please click the link, or if you have the American Red Cross app. We want you to actually register before you come. So it's really important that you register. They're trying their best to practice social distancing as well, and so they really want you to register. If you're willing to give blood, please do it Wednesday at Cooperative Extension or Friday at Deep Run First Baptist. But first, follow the link that we're going to post here to the story, and then actually go and register before you come. The other one is, we've got a very, very active Facebook group called We Report Neuse News. So wereportneusenews.com. There's a lot of neighbors helping neighbors with questions, with answers. As a news organization, there's only so much we can manage all at one time, especially with a small staff. But there's power in numbers. And the really neat thing about our Facebook group is it's not just a bunch of people blabbing and fussing about stuff. There are actually moderators who are making sure that people stay on the topic. We remove content that should not be there. So we are pruning this Facebook group to make sure it is meeting the needs of our community. So please join our We Report Neuse News Facebook group to help your neighbor in time of crisis. Also, please feel free, if you want to support Neuse News in any way you can. Now, we are free, absolutely free. We always have been. We always will be. We are supported through our business advertisers, and we know that is going to be a tough market going into the future of the next 3 or 4 months. If you just want to chip in to help Neuse News in any way, we're going to print these limited edition #NewsCrew t-shirts. They're really cool. And you can actually just, we'll put the link, you just kind of chip in whatever you give. Also, we're going to send you, we'll make sure you get a t-shirt. We haven't printed them yet. We'll figure out the procedures on how to make sure you get them. But go to that link, get a t-shirt, put $5, $50, you name it. We've had a lot of people jump in already on that. So thank you so much for all those who have done that. You're also going to get a personal email from me as well. We really want you to subscribe to our Neuse newsletters in your inbox daily at 7 a.m. We have close to 4,300 people who get that email every single morning. thank you for that. If you want to get the latest on COVID-19 in our area, as well as find out what's happening with the honor roll at schools, or what's happening with our school system, or what's happening in crime, or things like that, please subscribe to the Neuse newsletter. That's at nonessential.com/subscribe. Also, we have made a special web page just for the COVID-19 crisis. Every article that we do that is related to the coronavirus, we tag it. And so if you'll go to www.neuse.news/CV, neuse.news/CV, we'll post that link here. Just bookmark that link. I have seen the numbers. A lot of people are using that link. In fact, yesterday we eclipsed the most ever website traffic in a 30-day period that we've ever had. There was 174,000 unique visitors over the last 30 days. And a large part is because we're trying our best to put out accurate and timely information to make sure that you are better prepared. And like Dr. Pradeep said, one of the best things you can do, honestly, is just stay home. And so Neuse is here to help you through that the best we can. And also, if you want updates on the COVID-19 across our state, you can text the keyword COVIDNC, COVIDNC, and you put it to the number 898-211. So you would basically send a text as if you were going to put in a phone number, and in that phone number you put 898-211, and then you say, well, to that phone number, I want to send this message, and all the message has to say is COVIDNC, COVIDNC, and you hit send message, and you'll get an auto response. Do you want this in English? You want this in Spanish? And I've already gotten a few texts. It's not too much. It's been just right. It's been some great information for our community. So again, thank you to Dr. Pradeep. Thank you all for jumping on. Please go ahead and make sure you share this in a Facebook message to somebody on your timeline. We're also going to have this on our YouTube channel, and you can watch this back. Maybe there was a question you knew was asked. You can go back and watch this from what Dr. Pradeep said earlier through some questions you asked earlier, as well as what you asked online. And also tomorrow at 4 p.m. we'll have North Carolina Senator Jim Perry join us as well. If you have some questions about how will unemployment benefits work, how will small business assistance work, what is the state of North Carolina doing, from the Department of Health and Human Services to emergency services, you name it, Mr. Jim Perry, Senator Jim Perry is going to come on and have a very similar discussion as we had today, but a little bit more on the policy and some of the protocols following all this. So with that, thank you, Dr. Travis Town, our senior tech engineer. Thank you to Aletha Thrower, who is our VP of operations, also helping with the social media chats and the questions and filtering. I actually have two different screens open, reading their comments and questions as well as yours. But thank you so much. Please like our page, Instagram, Facebook, Twitter, and I really appreciate it. Y'all have a safe evening, and stay away from as many people as you can.